maybe a few years ago, they built a whole new wing on the operating suite here at the hospital for you and your partner, Richard Millett. And I believe it was designed for you to do this fancy new procedure where you can get around the open heart surgery to replace the aortic valve. Would you tell us about this amazing technology that you now perform?
Yeah, so that's it's revolutionized aortic valve surgery by far and away, and it's called TAVR, TAVR, Trans-Aortic Valve Replacement. And so what that is the valve is crimped. It's mounted on a stent, just like the stent we talked about for the coronaries, but much bigger. It's the size of your pinky finger, and it's crimped down. And what we do is we place the valve over a wire that's been placed inside the heart.
All right, so you thread. Does this go up through the groin?
Through the groin.
Through the groin. So you thread up. And I got to tell you, folks, what this suite looks like. It's got all these X-rays and TVs and technicians and rooms and wires, and it's a whole elaborate construction here for this, primarily for this one procedure. So through the groin, you will thread a wire up into the heart. Now, how do you get the wire? I guess you have to go up the aorta and then down
up the
into
aorta
the valve?
And across the valve. With a wire, you just poke around until you get through the valve.
Okay.
Between the flappers. You're not going through the flappers, but between the flappers, where the hole is. And then you have a wire. We use a rigid wire.
Now, is this person's not on a heart-lung machine?
No.
They
can be awake. Yeah.
They can even be awake. So their heart is beating while you're doing this.
Yes. That's a huge advantage. Yeah.
Amazing. So the patient is maybe sedated a little bit.
Sedated, yeah.
Okay, so you thread a wire up through the groin, up the aorta, this major artery, over. There's an arch, and then you get the wire to come down. Then you get through the valve.
Through the valve.
Then what do you do?
Then in general, all we have to do is go up with the valve that's mounted on a stent. And there's
collapse. So it's
collapsed.
Skinny. It's collapsed. It's contracted. It's a small diameter.
Very small.
And you thread that bad boy up and into the aorta.
And then you release it. There's two ways to release. There's two valves. One is you release with a balloon. A balloon blows up and stretches the heart, the valve.
So you've got the old valve. It might be tight, might be damaged, might be calcified or something. Yeah. And you literally expand it or crush it. You crush it open.
Out of the way, yeah.
Out of the way. So now that's out of there. So now you've got an open tube.
Yes.
And then what do you do?
Well, there's the stent, and inside that stent is sewn on a cow valve.
A brand new to you cow valve.
Right.
And that'll pack down and then open up.
It'll open up as soon as you
Amazing.
Open up. Yeah. Now there is the other type of stent. You don't use a balloon. You just extrude it out of the cat. It's trying to open up by itself because of the warm blood, and you just pull the catheter and it extrudes out. So you don't have to use a balloon.
It opens itself. So it makes a tight fit.
Yeah.
And now you've got a brand new valve right there.
So when we're blowing a balloon up, we do have to drop the blood pressure in the patient. And the way we do that is by using electrical conduction with a pacemaker and make the heart beat 180 times a minute, which is very inefficient. It doesn't have time to fill. And so at that point, the blood pressure just drops. So it induces a low blood pressure we're making it beat so fast that it can't fill. And that gives us that, because last thing you want to do is blow up a balloon against a beating heart. First of all, the heart doesn't like that. It's a muscle squeezing against completely locked out muscle trying to squeeze, so that's bad for the muscle. And plus, you can move the balloon might move out of the way while you're trying to point, and it ends up somewhere else where you don't want it.
It has to be properly positioned.
It has to be,
That's why all those real time
X-rays
that you're taking and watching it in real time.
Yeah,
it's called fluoroscopy, isn't it?
Yeah, that whole room is designed to do all that to the tune of $1.8 million.